On Friday morning at the GU ASCO Symposium, I presented updated interim analysis from KEYNOTE-057, which is a Phase II study, single-arm, of Pembrolizumab in high-risk non-muscle-invasive bladder cancer that is BCG-unresponsive. The context of this study is BCG-unresponsive high-risk NMIBC, and to specifically define it, these are patients who have CIS with or without papillary disease, which is specifically cohort A of this particular study, who had received adequate BCG and then unfortunately had developed BCG-unresponsive disease. And classically for these patients, radical cystectomy is considered a standard of care. Historically, we do have had other salvage therapies that can be administered intravesically with the idea of delaying cystectomy and helping patients keep their bladders longer. However, the responses to these salvage regimens are often very transient. So it was in this context that Pembrolizumab was tested. Specific to the design of this trial, it focused on two cohorts, Cohort A, which I just mentioned, and Cohort B. Cohort B, which I did not present, specifically focused on patients with only papillary disease, which means without carcinoma in situ. These are patients with TA or T1 lesions. And then Cohort A, which focuses on patients with carcinoma in situ with or without papillary disease. I presented the interim analysis of the first 102 patients who were treated on this trial. So with the analysis so far in this updated interim analysis for KEYNOTE-057 demonstrated is that at a median follow-up of roughly 16 months, we've observed a 40% complete response rate in the bladder in patients with carcinoma in situ, and that about 53% of these responses are lasting 9 months or longer. And right now, based on a follow-up for the patients in a CR, which is about 17 months actually for the patients in the CR, that the median estimated duration of response is about 12.5 months. This preliminary activity is encouraging, suggesting that for patients who achieve a complete response to Pembrolizumab in the bladder, that perhaps at least half of these responses could be durable, possibly beyond a year. And this is meaningful essentially because it helps patients keep their bladders longer, and hopefully these responses will be durable. The safety profile for Pembrolizumab in this study was as expected. About 2/3 of patients had at least one treatment-related adverse event, but that also means 1/3 had no treatment-related adverse events, and that about 13% of patients had a grade 3 or 4 toxicity. The rates of immune-related adverse events specifically are relatively low. All were manageable, essentially with corticosteroid therapy. Only about 8 patients discontinued treatment due to toxicity. So overall, treatment was fairly well tolerated. Additionally, for the patients who may not have had a response to therapy or had initially a response and then progressed, none had progressed to muscle-invasive or metastatic disease, which is also an important consideration. So in summary, the data are quite promising. The safety profile is what we would expect. These are encouraging data, but they need to be certainly followed for a long-term follow-up to see how durable these responses truly are.